This program is brought to you by Emory University.
My name is Sita Ranchad-Nilsson, and I direct Emory's Institute for Developing Nations. On behalf of the co-organizers of the Emory Faculty and Community Discussion Forum, I want to welcome you to this, the second event in our series this spring semester. Emory University is a leader in patient care and public health, and in local, national, and international efforts related to the Ebola pandemic. In this series, we highlight some of the ways that the Emory community is engaged in ongoing global efforts to address the Ebola pandemic, with an eye towards addressing the current situation and also to improving preparedness and emergency response in the future. The Emory Ebola Forum and Community Discussion Group is generously supported by every school at the university. The series has been organized by the Nell Hodgson Woodruff School of Nursing, the Institute for African Studies, and the Institute for Developing Nations. I want to take a moment to gratefully acknowledge my other co-organizers in this series. Dr. Deborah Watkins-Bruner is professor and Robert W. Woodruff Chair in Nursing and Director of Faculty Mentoring at the Nell Hodgson Woodruff School of Nursing. She is also Associate Director of Outcomes Research at the Winship Cancer Institute, and last year served as co-chair of the Emory University Commission on Liberal Arts. Our other co-chair is Professor Pamela Scully. Professor Scully also has the honor of being the first presenter today, so I'm going to hold off on her proper introduction for just a moment. I also want to take a moment. This is a 7-part series and has required a lot to pull together. So I'd like to acknowledge our staff at IDN, particularly Keisha Haywood and Judy Phillips, who have worked very hard to pull this all together. Information about the forum is available on IDN's website. And if you go to IDN's website and you click on the little box that says Ebola Forum, it will take you here. As videos of the events become available, we will put them there. As other materials and resources become available, this is where you can go to find them. We also want to encourage you to share your thoughts and questions via Twitter using the hashtag Emory Ebola Forum. We will look for questions on Twitter following our presentations today. Before we begin, I also want to draw your attention to a new Coursera course on Ebola that is being taught by 2 of our colleagues, Professors Carlos Del Rio and Dabney Evans. For more information, you can go to the Coursera website. They have a fabulous promo video that is very engaging, and the course begins on March 31st. Our session today is entitled Ebola, a Neoliberal Disease, Economic, Political, and Social Impact in Liberia. Our speakers will focus on how history and development have shaped the outbreak of Ebola in Liberia, what the Carter Center's Access to Justice project is doing to address Ebola now, and what the outbreak means for Liberia's economic future. Our first speaker is Dr. Pamela Scully. Dr. Scully serves as Assistant Vice Provost for Academic Innovation and Director for the Center for Faculty Development and Excellence. She is Professor of Women's, Gender, and Sexuality Studies and African Studies, and works closely, I'm happy to say, with the Institute for Developing Nations. Professor Scully was part of IDN's working group on gender-based violence in Liberia in 2008 and has since been involved in numerous research, conferences, and programmatic initiatives focused on gender violence in the region and beyond. Professor Scully is a historian whose research focuses on comparative women's history with a recent emphasis on biography and on sexual violence in war and post-conflict. She is completing a short biography of Ellen Johnson Sirleaf, the president of Liberia. Professor Scully.
Thank you so much. Here we go. Before I start, I'd just like to say it's a bit, just bear with me because I look around the room and see people from Liberia, experts on Liberia, people who've traveled there many times, and maybe some people who don't know where Liberia is. So I'm going to try and speak to you all, but I'm either going to say too much, too little, or, something too simple. But here we go. The quote, a neoliberal disease, I actually heard when I was on a panel at the African Studies Association conference, and somebody from the audience stood up and spoke about Ebola as a neoliberal disease and said they were quoting a Sierra Leonean academic. And I don't know who that academic is, but I was sort of taken with the phrase. In the course of trying to do this talk, I realized I'm not sure that I know what I'm talking about, so it still sounds great. Okay. So this is the Ebola. So what I'm going to do is really talk about the history and politics that enable us to understand why, particularly in Liberia, which I know best, why Ebola took hold so badly and has been so difficult to treat. But I'm not going to talk about Ebola at all, really. But this is the region, as you know, West Africa. These are the Ebola-affected countries. Not this one, but Liberia, Sierra Leone, and Guinea. This map actually represents a region called the Mano River region. But the Ebola-affected countries are Guinea, Sierra Leone, and Liberia. So as you probably know if you've been following the news, especially the news that came out last fall, is that there were reports of people in all the countries running away from healthcare workers, of people hiding relatives once they knew they had Ebola from healthcare workers. And quite recently there was an attack in Guinea on people who were thought to be healthcare workers. It turned out they weren't, but they were attacked for being health experts. So why? Some of the explanations that have been given in the media are things like that people in this region don't understand what experts do and that they were there to help, that people in the region were uneducated and naive in refusing help and in refusing to send their relatives to healthcare stations. Other reasons given for the spread of Ebola were that people were engaging in unsafe funeral practices of washing the body and being in touch with the body when it's particularly virulent. And those all seem to me to be cultural explanations, and not so much cultural explanations resident in Liberia, but cultural explanations from the point of view of the Western media. So for me, it still led to the question of why. So I think one of the things I'd like to talk about, and I've been doing some reading so that I'm not the only person saying this, is that there are underlying structural reasons for the spread of Ebola in Liberia, in particular, which I know about, but also the other areas, which have to do with really complicated histories. So Jared Jones of Yale recently wrote a blog saying, global forces condition the emergence of Ebola far more than culture does, because culture is seen as kind of a problem. Inequality, inadequate provision of healthcare, entrenched and exacerbated by a legacy of colonialism, superpower geopolitics, and developmental neoliberalism are responsible for much of Ebola's spread. There's some lovely words in there, superpower geopolitics, developmental neoliberalism. We might get to some of them. So just to say, neoliberalism is it depends, who you're talking to, but neoliberalism is generally, at least one definition, is tied to a set of policies emerging in the 80s around the Reagan and Thatcher revolution that stressed the importance of free trade and if you were in debt, to take away from investment in social services. And the key policies it's associated with are policies of structural adjustment, which particularly affected the global south, which many countries were in debt to the IMF, to the World Bank, And in order to relieve the debt, they were told, stop investing in social services like education, healthcare, to pay off your debt. And once we see you doing that, we will maybe forgive some of your loans. And that's one of the reasons that people talk about Ebola in West Africa as neoliberal disease, that it emerges from certain monetary policies governed by international monetary organizations that affected the region in a way that they couldn't build infrastructure. And I think some of that is true, but I also want to talk to the complex historical reasons and contemporary reasons why that will help us explain, or understand the spread of Ebola. So at least one structural reason is that, just to go back to the map, is that all the countries affected by Ebola were like virtually, every country in Africa except for Ethiopia, actually, were all had colonial histories. Britain was the colonial power in Sierra Leone, France in Guinea, and America to some extent in Liberia, although America actually was never a colonial power in Liberia. It was settlers from America who went to Liberia and settled Liberia in 1847. But there's a long history of tensions going back to the mid to late 19th century in this region between colonial powers, or like the French or British in Sierra Leone, or the descendants of Americans in Liberia, between them and indigenous authorities in the region. So all these countries have a very long-standing tension between the kind of colonial state and then the post-colonial state and indigenous people who'd been living there long before any settlers arrived. Also, all these countries are very, very wealthy in mineral resources, and they also have a history of multinationals making deals that basically favor the multinationals, and they create mines, but the money goes out. So there's a long-standing tension between state and local people, between how investment is made in these countries and who gets to benefit. And Elmira Woods, a Liberian social justice analyst, argues, quote, the neoliberal economic model assassinated public infrastructure. So these are the kind of things that people talk about when they're looking beyond just Ebola. Okay. What I want to do is just talk quickly about, really Liberia as an extreme case in point around the effects of having so many minerals, warlord economies, and historical legacies for the present. And that is a map of Liberia. Monrovia tells you something about the history of Liberia in that, does anybody know who Monrovia is named after? James Monroe, exactly, an American president. So Liberia too has a history of tensions and inequalities between settlers who arrived in the sort of early mid-19th century and continually into the 20th, and indigenous people. And this is the contemporary motto of Liberia, although there's some suggestion it will be overturned. And you can see the problem right here. It says, the love of liberty brought us here. And you have an old sailing ship coming and a plow, etc. But who is the us? It doesn't refer to all the people who were, of course, never had to travel to be there. That's where they were born. So the fact that you still have this as the motto of contemporary Liberia speaks to this kind of profound tension. Also, Liberia has a particular relationship with multinationals, exemplified by their relationship with Firestone. And when I say the vampire state, that is a term that's used in some political economic sort of analyses, which is of a state, often a colonial state or a post-colonial state, that exists only for the point of extraction. And this is the case in many of these countries. The state is not a welfare state like in Sweden, where everybody goes, oh great, they're paying our childcare, etc. The state in many of these countries is seen literally as a vampire, well, literally or metaphorically as a vampire that sucks things out of people's lives, doesn't return to them. Okay, so Firestone contributes to that. In 1925, the Liberian government, through a semi-forced deal with Firestone, supported by the American government, made an agreement to rent up to 1 million acres of land at 6 cents an acre for 99 years. So we're still, it's being renegotiated. And to pay a 1%, Firestone had to pay a 1% tax on the gross value of exported rubber. What happened was that Firestone then controlled 4% of Liberia's landmass and the rights to any of the natural resources in that land, and was exempted from taxes under certain conditions. And the government of Liberia guaranteed labor and depended upon local chiefs through coercion and taxes to supply that labor from their villages. So, and Firestone makes most of the tires that we use in our cars. So there's a historic relationship between this particular multinational and the Liberian government, which there was a commission of inquiry in the 1920s around terrible labor conditions, of accusations of slavery. The Firestone plantation plantations have very difficult histories in Liberia. The other structural condition that we have to consider is also the relationship with indigenous communities, that for Liberia became an independent country in 1847, and the first person to be a president of Liberia who was not of the settler class was Samuel Doe, who took power in a coup in 1980. So you have a history of settler government, in a sense, in Liberia, with very tense relationship with indigenous communities, various attempts to kind of bring the interior under the control of the capital, etc. But also, Liberia shares with Sierra Leone, and to some extent Guinea, but particularly with Sierra Leone, a legacy of war. So Liberia was riven by war in 1989, 97, 99 to 2003. Child soldiers, terrible displacement of the communities into neighboring countries as well as internally. Charles Taylor is sitting in prison right now. He came charged with various things in relationship to the Sierra Leonean war, but he was president. So by the time the war ended in 2003, what infrastructure there was in Liberia no longer existed. And again, because of that other history of inequalities in Liberia, there are very few roads in Liberia. Once you get out of Monrovia, there may be 2 or 3 main roads for the entire country. Schooling was basically concentrated in the capital. So when people say, oh, the war, really made things difficult for Liberia, it's not just that. It's also this much longer history of 150 years or so. I just put down Pat Robertson because if people know about Liberia, they tend to know Charles Taylor's a really bad guy who stole diamonds, blood diamonds. What they don't know is that the Pat Robertson, of evangelical fame, actually did a deal with Charles Taylor to investigate mining gold in southeastern Liberia, and okay, that's just a FYI. Okay, so you had these warlords parading around Liberia, making deals with companies and stealing mineral resources. And so in 2006, when Ellen Johnson Sirleaf, who won the Nobel Peace Prize in 2011, I think it was, when she took office as the first female president, she said, our abundant natural resources have been diverted by criminal conspiracies for private gain. Okay. Also, you had structural adjustment pressures. So, because for the same reason, the 80s, the same kind of structural adjustment pressures were put on Liberia. So that, for example, if I can read, in 1980, Liberia's foreign debt was 537 million. By 2003, at the end of the war, they owed 3 billion, which could not be paid. I mean, it could not be paid. You can't invest in infrastructure if you're swimming under debt. Okay, so when Ellen Johnson Sirleaf became president, she brought lots of development aid, and I call Liberia Development Central. But one of the results of this is that there have been a lot of experts working in Liberia, telling people what to do, driving around in UN vehicles. A lot of money has been spent. A lot of talk about how Liberians and Liberia lack capacity. But what it's led to, I think, in the end, after all the amount of money, is that people don't see the results. And they say, well, the experts clearly aren't expert because they're not actually helping, or they're taking the money away. There's a growing skepticism of government. And while, again, Ellen Johnson Sirleaf has done a lot, and she's really tried to work on these issues of concessions, but she's also in a bind about how to improve Liberia. But from 2006 to 2012, you see the government has signed all those concessionary agreements which extend over a quarter of Liberia, again, to multinational companies doing mining, iron ore in particular. A big Chinese company doing iron ore investigations and mining in Bong County. So this has led to these kind of tensions. I know I had a minute left about 2 minutes ago. Okay, so basically when Ebola comes, you have a great skepticism actually within the population of experts. They know there are no hospitals really, one hospital in Monrovia, there are virtually no doctors, the healthcare system doesn't work. So, and they saw that if someone got sick and they went to the healthcare center that was barely there but existing, then they died because the people who were dying were the healthcare workers. So there's labor unrest on the mines in a growing sense, and that's the Liberia that Ebola came into. And then finally, I just want to say that one of the results of this changing land use in these forested regions, as this epidemic, he's a biological something or other, let me tell you, evolutionary biologist, is that land use itself is changing, which is actually exacerbating the spread of Ebola because the forests are being, sort of eradicated. People are thrown out of work. They're becoming much more in contact with things like bats that carry Ebola. So the point is that there are all sorts of issues that we need to discuss when we think about Ebola that don't come up in the discussion, and it's not just about culture. And so these are some of the reasons that people gave initially for Ebola. But now we know, I think there are 5 cases, maybe 4 now, left in Liberia. And what's interesting, it's not the expert, it seems to be not the experts who have eradicated Ebola. It's the people did change their practices. They stopped touching each other. They did learn about trying to have burials differently. But it was actually really simple things that have stopped Ebola, not all this complex issues. And then, again, we're left with, the effects of Ebola are going to last forever, well, for a very long time. And this was a very recent poll that was done. And you can see people are skipping meals. They worry about not having enough food to eat, etc. And then, and we can send this out, but these are some of the readings that I found most helpful. Thank you so much.
Now it is my pleasure to introduce Pewee Flomoku from the Carter Center, Liberia. Pewee Flomoku is the chief of party for the Carter Center, Liberia. In this role, he is responsible for overall technical, operational, and financial management of the Access to Justice project. Mr. Flomoku also coordinates with other Carter Center projects in Liberia, including the Access to Information project and the Mental Health program in Liberia. Pewee Flomoku's background is as an award-winning photojournalist whose photo and video coverage of the Liberian Civil War is internationally known. Most recently, he has been in charge of the Carter Center Liberia's efforts to support the Ministry of Health and Social Welfare and the Ministry of Internal Affairs as they work to address the Ebola crisis. Welcome, Pewee.
And what we've been doing to help the chiefs, our partners, the Ministry of Internal Affairs, Ministry of Health, to get involved. As agreed, I would just run through a little background of our Access to Justice program. We started sometime back in 2006 with a request from the Ministry of Justice asking the Carter Center to come into partnership to help sensitize rural citizens in the rural parts on the issue of the rule of law, discussing access to justice. And so the Carter Center agreed to come in partnership with the Ministry of Justice and to work with rural citizens, primarily in rural areas. The project is in partnership with the Ministry of Justice and the Ministry of Internal Affairs, and is implemented in collaboration with the Cabinet Justice and Peace Commission and the National Council of Chiefs and Elders. The project has provided civic education, community justice services, dispute resolution, capacity support to historical marginalized communities, and as I listened to Pam, there's been a problem of age with regards to the divide. So our work is primarily targeted at the most rural part where that is hard to reach. People who don't have access to information, access to healthcare, access to justice. These are the people we reach, and then we work through civil society organizations, mainly the Cabinet Justice and Peace Commission, where we've been able to train some 52 civil society actors that we refer to as community justice advisor, and we had to negotiate that name for the fact that this is a paralegal program, but we couldn't call it that for some other reason with Liberian lawyers. And so we've been working on that. And in 2014, the center began to get funding through the Swedish government. Before we were getting funding from USAID, going to continue the kind of work that we're doing. So currently we've been funded by the Swedish government, operational firms that has been carrying us all through. And also, like Sila said, we have other components of the program, like a mental health program that is helping to train clinicians who are now specialized in giving support to mental illnesses. We also have the access to information component that is helping to link the work from the government to the rural communities when it comes to information sharing. So particularly what we've been doing is helping to train chiefs, youth, and women in rural communities. And the initiative through the civic education has helped a lot to be able to draw the chiefs full support to the government, the national government. In the areas that we're working, like I said, those are areas that are caught up. We hear about development in some of the areas. So we are reaching those communities through the community justice advisor providing support. So based on the kind of work that we do and the kind of cases that have been coming, in 2010, we decided to add another component to strengthen the capacity of traditional leaders to advance good governance. And this all came up as a result of requests from our partners, the kind of work that we've been doing. So the College Center worked with traditional leaders to be able to reach out in local areas to get involved in dispute resolution and land dispute, inheritance. And one of the issues that we've been faced with is the issue of traditional practices, especially when it comes to the rights of women. So we've designed our work in a way that we've been able to connect that part of our work where chiefs can work closely with women to address some of the issues that the women face at the community level, and this is a real challenge. So based on our experience in working along with chiefs and elders at the community level, in resolving disputes, land conflict, looking at our traditional practices, we got a call or an invitation from the government through our partner, the Ministry of Internal Affairs, then serving as a co-chair to the incident management system, to come in to help during the outbreak of Ebola. Because by then, all of the actors were in Monrovia designing programs, trying to find means to see how we could all tackle this epidemic. But nobody ever thought about community engagement then, which was a challenge because we were all designing programs and going out to the community to implement. But they were not helping because the community back then was not involved. We were not targeting the community, getting a view on how we could engage, for example, on community interest. So the College Center agreed and they requested our donor, the Swedish government, to allow us to reprogram our activities to work around supporting traditional chiefs and elders, in looking at, for example, working with contact tracing teams, surveillance teams, and discussing the issue of safe and dignified burial that came in later. Because at this point, there were a lot of challenges and there were a lot of confusion when people were in serious denial. So it became a problem for our partners who were working in these communities. There were denials, and some of the times they came out and resulted into violence because the community did not take calmly the issue of Ebola. The first denial was they thought it was a man-made issue, and so people who were leaving, who were coming as expert on this issue were challenged. So our involvement was to bring the chiefs around the table to see how they can help in addressing some of the concern. And we noticed that the disease was being spread mostly through contact and other traditional practices, including burial, other ceremonies that were performed at the traditional level. So we conducted an assessment at the county level in the 15 counties to engage the chiefs to see at what level we could start working with them. What was their involvement? What was their thinking? What was their level of understanding this whole issue of Ebola? And after that assessment, we noticed that they had no information. And so we had to now go back to our partners, the Ministry of Health and Social Welfare, to design other programs as to how to reach to the traditional chiefs and how to get them involved in supporting the contact tracing team, for example, or burial teams. Excuse me. So all of these are coming together help us a lot to see how we could shape the thinking of the chiefs. Because we know that in Liberia, traditionally the chiefs are in power, they have the information, they have the respect of the communities. So getting them on board was going to help. But it was a challenge come on the other side for the policymaker to agree that the chiefs could take a lead. After our county-wide assessment, and we made some reports, and like everybody kind of agreed that we needed to engage the chiefs and to get them on board and start to help. So we conducted, with support from CDC Foundation, we conducted a district level assessment to see what level of preparation we could do with the chiefs to go back. And as a result of that training, we got additional information to bring our chiefs from the 15 counties to engage partners. So the chiefs then wanted to know the role of the government, the role of partners, each partner, for example, UNICEF, WHO, CDC, UNFPA, Carter Center, and other partners. They wanted to know the role, what were they doing, and how could the chief get involved. At this time, the conversation was going further, and they were now getting involved. So we brought all of them together for the whole week, and we had a very good discussion, and there were recommendations after that. So going by, one of the recommendations was to conduct training at the district level. So we were going from county level to district level. And here, under the chieftaincy, you find that you have a town chief, which is at the lowest. You got a clan chief, you got a power chief, is the most senior traditional leader. So these people wanted to go at the district level because the lower you go, the more people you get to engage. So we decided to conduct this training with the help of the Ministry of Health and Social Welfare, providing master trainers. We were training county level trainers to work with the chiefs. And after this training, it is expected that the chief then will begin to help the district health officers to, for example, provide information. Say in a day in this room, thank you, you'll be able to provide information regarding your village. If somebody is sick, you can provide that information to the district health officer and they will respond. So the chiefs are now doing that. We've provided transportation, we've provided phone communication to them, that they will be able to help active case search, active case farming. So in conclusion, as we see the reduction in the spread of the virus right now, is as a result of all of the actors coming together and working with the community. Community engagement is what is helping to reduce the virus. And people are now accepting what the experts are saying, the way to prevent yourself, taking the campaign from the president, Ebola is everybody's business, protect yourself, your family, and your community. So that's the approach we've taken, and that's what we're working on. And I know like I've gone all the time, but in question and answer, I can talk about some of the impacts. We have the issue of stigma for survival, that is a challenge. People are going back from the ETU and they are being denied in communities. These are issues that we have to deal with. Our colleagues from the mental health side of our work are seriously handling this. It's a big challenge because you don't have funding for psychosocial services. our colleagues from the Access to Information are also doing their best, working with the government to channel information properly to all of the communities through our community radio programs that we have. Politically, it's been a challenge. Also, there are political impact. But socially, we have a lot of orphans, and we have a lot of survivors that are being stigmatized in the community. So these are issues that we are still dealing with. But let me stop there, and I will be open up to take questions. Thank you, guys.
Thank you, Pewee. Please stay with us. Now it's my pleasure to introduce Jeff Rosensweig. Professor Rosensweig is an associate professor of international business and finance and director of the Global Perspectives program at our Goizueta Business School. Prior to joining Emory in January of 1988, he was a senior international economist at the Federal Reserve Bank of Atlanta, and he is a member of the U.S. Council on Foreign Relations. Professor Rosenzweig's research focuses on business linkages with the emerging global economy, the implications of globally divergent demographic trends for business, and factors affecting competition in the global travel and tourism industry. Professor Rosenzweig.
Well, thank you. I can now see why Sita is the director of the Institute for Developing Nations. She just pronounced Rosensweig and Goizueta correctly. That doesn't happen very often. You know, I've got a very tough task because I want to actually make my part shorter to make sure there's time for questions for you, especially because there's so many students here. I'm also in a tough position because at first I was asked to speak about the economic impacts of Ebola, which are tragic, not as tragic as the disease itself. And then all of a sudden up came this topic about neoliberal. So I think I'm representing the capitalist pig, colonialist, post-colonial, neoliberal, IMF structural adjustment guy, whereas actually I'm pretty far left of most of the people in the business school. And for 12 years I was the chairman of the Ethics Center at Emory. We of course have a wonderful director, Paul Volpe, and I'm on the Latin American and Caribbean Studies faculty. Of course, on that I represent the capitalist also. So let's talk about capitalism for a while. When some people look at a market, as we like to think of these nations as nations, but also emerging markets. Yes, they are markets for global companies like a Coca-Cola or Nestle. They're also a place where Nestle will go into some of the countries Professor Scully pictured and extract coca, for instance, to make their chocolate. But also we think that there are aspects of global capitalism that can help countries develop. It's partly due to the role of the company from a wealthy nation, but it's also due to the governance in the country itself. So one thing that Professor Scully pointed out is governance and local issues probably are just as important as issues coming from the capitalist side. There are countries in Africa that have made tremendous strides in their governance. Most notably Rwanda, where after a genocide there was more pressure in some sense to say, how can we achieve some economic development? How can we achieve more rights for women? Now, I'm not saying that many of these nations are democratic ideals. For instance, in Rwanda, Paul Kagame, I think he's the only one alive right now who has won 3 wars, by the way. It's not that you would call him the super Democrat, but within their structure, there's I think it's a 40% limit. There has to be at least 40% of the persons in parliament are women within corporate boards. The only nation that even rivals Rwanda for making sure women get representation is Norway, of all places. In Nigeria, it's easy for people to talk about corruption and lack of governance, but as an economist, I like to look at the time series, at the evolution over time, and a number of these nations have achieved, Ghana, Uganda, much better governance within their nations. Botswana looks like it's growing at a slower rate. what this is the growth of a nation's real GDP. Real means inflation adjusted. You know, the income can go up because you have a lot of inflation. The prices go up. This adjusts for that. GDP is the total production of goods and services. Because, of course, in our societies, we have education services. Up the road, we have healthcare services, etc. Now, to give you context, there are a range of countries, of course, Africa, that have achieved economic growth. This is compounded growth per year of over 4%. And some are near double digits. We're about to see that Liberia has been near double digits, but I couldn't include them in the graph because, as you showed, they were at war up to 2003. And what I wanted to show you this is to put context how too many people, when they think about economic development in emerging markets, they talk about the BRICS: Brazil, Russia, India, China, and they're completely missing something that we call frontier markets, which are a number of places in Africa that are emerging from just dire poverty into rapid economic growth. Now, that growth in some of these countries, sadly, is not reaching all the people. But if you look at a lot of Latin American countries that have opened up to some forms of global capitalism, do you know that the poverty rate in Latin America is half of what it was 15 years ago? Not that there aren't a lot of problems and structural problems. And the poverty rate in some of these nations is high, but much less than it was. And the same thing for the tragedy of female illiteracy, much lower in a number of these nations. So, to give context, and then we move to Liberia, the U.S., in a good year, our economy would grow 3%. In Europe or Japan, 2% would be a good year. This doesn't mean these countries, even though they sustained rapid growth for 13 years, doesn't mean they're rich yet. But if you sustain these kind of growth rates for a long time, you're moving from poverty toward a lower middle class, and you can begin to have a better hope for your children. Except for nations in the southern cone of Africa, which have had not the situation of Ebola, but of HIV/AIDS, there's rapidly increasing life expectancy in a number of these nations. The reason I wanted to mention Botswana is everything Professor Scully said is true, that if a nation allows itself to be exploited by just by extraction, it won't do as well. Botswana set in place policies. They wouldn't let a firestone come in and say, we're going to take everything and leave nothing behind. And the reason Botswana seems to be growing slower than the rest, although faster than any other advanced economy, is it grew fast in the 1990s even before, so it already got to a high level. I would like you to think about reading a book that is not very deep in its economics, not technical, but really interesting, called False Economy. And it does draw a dichotomy between nations subject to the natural resource curse, where the natural resources actually curse them. There has not been an ability to grow the livelihood of people, but nations like Botswana that have overcome it. The question for Liberia is, as they are attracting so much investment into iron ore, as they used to in rubber, when you think of Firestone, and as they still have a lot of production in rubber, will they subject themselves, through bad governance, to the natural resource curse, which I will show you what that means and why it could visit itself upon Liberia? Or will they learn the lessons from Botswana and others, how to make sure they get something out of a partnership with a Chinese company, for instance, that wants to extract their iron ore? Okay, looking at Botswana, again, we have Liberia. We have to look after the war ended, of course. In 2002, things didn't look very good in a war. But look at the growth of the economy of Liberia from 2005 right through to the forecast for 2014. What do we see? We see, number one, tremendous growth, even more than the growth of sub-Saharan Africa in general, which has some nations doing poorly, which pull down the overall growth rate. But as I just showed you, a plethora of nations growing very quickly. The other impressive thing about Liberia is it even grew well in 2008 and 2009 when the world fell into the Great Recession, when Lehman Brothers and these investment banks went broke, the housing booms in the US and Ireland and Spain, et cetera, crashed. Our economy went 4.5% unemployment up to 10%. Most economies in the world were so impacted, and Liberia was doing so well, their economy kept growing. Yes, inequality, but when there's that much more money around, some of it does get out to the people. But as we heard, there wasn't enough investment in health infrastructure. And Ebola spreads, but I really still had a problem understanding the full reason that Ebola was caused by capitalism. Maybe that'll come up in the Q&A. There are capitalist countries with inadequate health infrastructure. There are socialist countries with inadequate health infrastructure. So we'll get to that later as I try to understand that. But Ebola spreads in a geographic area, and it pulls the economy of Liberia off of a wonderful path of economic growth into recession, where the economy recedes. And of course, Ebola really only started diffusing in the second half of 2014. So really the second half was a tremendous negative economic impact. When tourists stopped going, international business people would stop going and look to invest. Iron ore, instead of contributing to the production, firms would pull their workers out. Liberians wouldn't go out to the fields. So most of the workers are in agriculture, something like 70%. It wasn't some neoliberal telling them don't go out to your fields. It was a fear of contracting Ebola. 2015 will continue a bad effect on the economy. Then the forecast is the economy will actually grow because of all the donor funds coming in. And now that Ebola does seem to be under control, the workers will come back in, both Liberians going out to the agricultural fields and foreign firms starting to grow. I have 2 slides to do in probably 3 minutes, but I anticipated that. I wanted again to put things into context, which is it is so easy to go through an entire degree program in some parts of Emory, not in the public health school, obviously, without ever hearing the word Africa. And you could go through the economics department, probably the business school if you don't take my class. And Africa really is achieving something that a lot of people never would have predicted. I wrote my first book right here, and I said as we enter the 21st century, Africa's on a knife edge. There was a tremendous amount of infant death, and there's still too much, pollution, resource exploitation, all the way. I said, but there are some hopeful signs. And fortunately, from that knife edge, we've seen tremendous growth, as I showed you in the first slide, in a lot of African economies. We're also seeing a boom in the exports out of Africa. A lot of them are extracted resources, but also manufactured exports are growing as people realize about the young demographic in Africa and slowly rising educational levels. But remember I mentioned the world economy turned down in 2009. When the world economy turns down in 2009, in terms of a north-south divide, the countries of the north, US, Europe, Japan, we buy less. When we buy less raw materials and the price of raw materials goes down because not as many people are demanding it, and that hurts the exports, the sales out of a place like Africa that still does export a lot of commodities. And that brings us to the idea that fortunately the world economy came back and Africa's been doing well. But that brings us right to the current day, and here comes the natural resource curse. So Liberia, although 70% of the people are in agriculture, a lot of its growth has been exporting traditionally rubber, but now rubber and increasingly iron ore. So as these kind of global capitalists come looking for profit and looking to extract, they come in from the US, they come in from China, and they've developed iron ore. China, of course, now produces more steel than anybody. To make the steel, they need iron ore. They have coal, as you know, in China, polluting a lot. But as the world economy does well, coming into 2008, the iron ore price goes up. Everyone wants iron ore, helps Liberia. Then we fall into some tough times, iron ore price comes down. Then good times, iron ore price goes up. And now the world economy, as you know, not the U.S. economy. We stand alone in the U.S. as an advanced country, advanced economy, whose economy is actually growing nicely. You don't have to know much about economics to know Japan is slowing down, Europe's falling into recession, Russia's not in good shape, even some Latin American countries. So there's less demand for steel. There's not as many people building skyscrapers and cars. And if there's less demand for steel, there's less demand for iron ore. So its price comes down. And by the way, it's continuing to come down. That's hard on Brazil because they export a lot of iron ore. It's also very hard on Liberia. So you've got the economic impact, the negative economic impact of Ebola, which amongst other things hurts their nascent tourism industry. They were just developing a tourism industry. They have the world's best beaches for surfing, and they were just developing that. No one's going to go to Liberia now to go surfing, and that is just another impact of the tragedy. But this is the natural resource curse. When a lot of your exports, which is how you earn money you can use to buy medicine, money you can use to build roads, when you're a mono exporter, when you're very dependent on one export of an extracted commodity, you are very dependent on a world business cycle. And if the world business cycle turns down and they don't want your export, you can be hurt for a while. And that's happening in Liberia right now. So what's going to carry Liberia in the next year are donor funds. But in the long term, I think Liberia is increasing education levels, and if they will look out for the education of women, as other nations have in Africa, I still think in the long run, they're a country of the future. And that's the overall context I wanted to show you where I started. How many African countries are countries of the future?
The preceding program is copyrighted by Emory University.